Let's bring in Nur Baran Aksakal. She's a professor of public health at Ankara's Gazi University. Welcome to the programme. Tell us why people are hesitant to get a vaccine. What are their reasons?
Hi. I'd like to say first that the vaccine hesitancy is a very broad term and it has many roots. So it may be just because of the access problems, or it may be because of the lack of information, or even the technical needs that they need to take an appointment and they may not have done so. So we have to find out the rules why people are hesitant, or is it a real hesitancy, or is it an access problem due to a barrier?
And is there a difference between those who live in more urban or rural communities?
Yeah, I think so, because in urban communities, the things that I have listed are less. People have more information about the disease and vaccination process, and they have even a better access to the appointment system because it's need an internet and it needs a program that they need to use it. So it is better in urban areas, and the people are living with their more educated family members, so they may be helping them to do so. But in urban areas, mostly the risk groups, namely the ones who are older than 65 years of age, they have difficulties in taking appointments, and they have difficulties in understanding the messages that we are laying. So I think there is a difference. And in rural areas, in some parts of Turkey and in some eastern provinces, we have really low coverage. And that's why the persuasion teams are in place to meet this demand. And I believe that mostly they will be successful because they will understand the barriers and they will see why people are hesitant or why people are not getting vaccinated. Is it because of a technical issue, or is it because of some rumors that they hear, or is it because of something that they really can't go to the areas that vaccines are given? Or they may even not know that they can be vaccinated at home. So these teams will be able to teach them and help them to reach the vaccine when it is available. Of course, there are some wrong understandings or there are some rumors because this is a new vaccine, and these rumors may be reflected in a way that we really don't want to be. So these teams will be acting in this way, and we will also have a chance to understand the barriers, and we will also have the chance to increase the coverage rate.
And just, more broadly, what can be done to increase confidence in vaccines in Turkey?
Yeah, this is a very good question, because it's a question in mind in almost every country on earth. Not only it is related to Turkey itself, but I think it starts with the scientific discussions that the vaccine was very fastly produced, and it has been generated many rumors around the world, and this has been carried out to our country as well. And new formats of the vaccines like mRNA vaccines being widely used these days are the others. And the other one is that really people need to understand the need. What is my risk? Having a disease, and if I'm vaccinated, what's my risk? And if I'm not vaccinated, what's my risk? So this really defines the vaccine hesitancy issues and why people are hesitant to get the vaccine.
And
so there are. I'm sorry that this is what the misinformation and conspiracy theories are taking the scene.
Okay, and tell us, where are we with the Turkish vaccine?
Yeah, there are 7 to 10 new vaccine candidates that has been produced or in production line in the pipeline in Turkey, and 3 of them are the leading ones, and one is the vaccine virus-like proteins. It is being produced by the Bilkent University and Middle East Technical University. It's a big team, and it has some production facilities. So the phase 1 has been completed, and phase 2 studies is being carried out. And we're waiting for phase 3 studies by the end of August. And this means that we will be having phase 3 studies, and on top of that, we may have an approval by the end of 2021. And it's really a promising one. And we have also vector vaccines in the queue and the inactive vaccines in the queue, which has been started to be tried in the phase 1 trials. And also, VLP is also included in the WHO's candidate vaccine list, which is a good news for Turkey and the ones who are working on the production of vaccines.
Good news indeed. Nur Baran Aksakal, thank you so much for coming on the program. We appreciate your time and your medical expertise.